Honestly, have you gone to the hospital? Have you seen those people and what they go through? They go through terrible pain. Hey guys, welcome back to my YouTube channel. My name is Dr. Cynthia, and today we'll be talking about a list of medical tests that should be done before getting married. But before we start, I would like you to subscribe to my YouTube channel, like, share and comment on this video. Thank you very much. So the number one test on my list is genotype. Of course, genotype is very important and should be done before getting married. Honestly, you don't want to bring a child to this world and watch that child suffer or go through pain, because you see those set of humans, they have a lot of complication. Having a child with sickle cell can drain you emotionally and financially. You see that love that you have for that man that made you to take that decision in the first place. In fact, you start hating that man. So please, you can prevent all this by knowing your genotype before getting married. So the number 2 on my list is HIV, human immunodeficiency virus. Please, your partner have the right to know your HIV status before saying yes to you. In fact, you don't have to hide your HIV status. Anyone that wants to get married to you, knowing the fact that you're HIV positive should be the person's choice. And then the number 3 on my list is blood grouping. Blood group is very important for so many reasons, especially during the case of those medical emergency where you will need a blood transfusion. So it is good for you to know your blood group. So another reason why you should know your blood group before getting married is that it helps to prevent complication during pregnancy. Okay, for example, a woman that is blood group O negative who gets married to a man that is blood group O positive and then eventually gets pregnant, and then the first child happens to be O positive like that of the father. Usually the first child is not affected, but during delivery, the blood of the first child and that of the mother would join, like combine and form an antibody. So during the second pregnancy, if the second child happens to be O positive also like that of the father, so that antibody that was formed during the first pregnancy would recognize that second child as a foreign body, and then we start fighting that second child. So most of the time, those women usually come down with miscarriage or come down with stillbirths. So what I'm trying to say is that the fact that you're blood group O negative doesn't mean that you cannot get married to a man that is blood group O positive, or if you are blood group O positive doesn't mean that you cannot get married to a man that is blood group O negative. What I'm trying to say is that there's a medication that can be given to prevent all this from happening, and it is known as Rogam. It is usually given during pregnancy, after delivery, and if there's any miscarriage, that is when it is given. And then another test that should be done is fertility test. Fertility test should be done to prevent any drama in your marriage, because I've seen situations whereby couples were married for years and they were unable to have kids, and they actually thought it was the woman's fault and later found out that it was a man's fault and not the woman's fault. So please make sure you do your fertility test and semen analysis before getting married, or before saying yes I do to that love of your life. So guys, if you find this video helpful or supportive, please give it a thumb up, share, comment, and don't forget to subscribe to my YouTube channel. Thanks for watching.